All right, good morning, everybody. Um, Today, our friend Terry Foster is going to present on bizarre and weird cases from the ER. And I think we'll have a few good stories for us all. So without any further, I'll let Terry take over, and thank you guys for coming out and visiting with us.
Okay, thank you, Tony, and welcome. The official title of my talk is "The Bizarre and Spectacular Unique Cases in Emergency Care," and I can tell you this is about 50% learning, 50% education, and then whatever else is wound in there, and plus you get credit for it. So hope it'll be good for you all. I'm going to share my screen here and. Let me just find this. Okay. Okay, so you can see that screen, I think. Maybe Tony, just tell me if you can't or something, if that's all right. Okay, thank you. So anyway, obviously worked at St. Elizabeth for a long time. As of this year, I've been an ER nurse for 49 years. I can't believe I'm saying it, but that's the truth. I graduated from nursing school in 1977 and had worked at ER already 2 years as a unit clerk and started working right then. Fell in love with the place when I very first began in the ER as a volunteer up in the top left picture. When I show this slide, I know that it's someday they'll be showing this at my funeral. So you got kind of a preview of my funeral. Okay, so just so you know that. But I also ran on Tailman Life Squad from 1973 until about 1982. And that was when our squads, they called you at home if they needed a squad. And then we graduated to them setting the tones off, like for one of our scanners. So anyway, been doing it a long time. I don't know everything, and I haven't seen everything. I have people say, well, I bet you've seen it all. The day I say I've seen it all, something else will happen an hour later that I've never seen before. So I don't say that. That's sort of like saying it's really been quiet today. Okay. There's just things you just don't say. That also ranks up there with we haven't had a code in so long. And then I think the worst one we never say in this line of work is, you know what patient we haven't seen in a long time? Because as soon as you say that, by golly, they're there. You got to take them. You got to take care of them, whatever. So whoever said their name is the one that has to take care of them. Okay. So anyway, so in thinking about this talk, and I've done this talk many times. Some of you may already heard it. I change it up, change it around now and then just to kind of see how things go and stuff and just different stories to kind of add to it. But there is a learning component to it that I like to promote. And it is especially with storytelling and our experiences and obviously telling people about those experiences as well. So I'll kind of expand a little bit on that because we all have various levels of experience and things like that that we of course bring to the table here. So just some thoughts I'll just go over. You are encouraged to tell your story. You're encouraged to be truthful and factual. And then do you realize? I got to go back. Do you realize how much we learn through storytelling? And sometimes I don't think people realize that. But when I talk about telling your story, I hope that you share those stories with your newer counterparts or somebody who you haven't worked with before. And when I share a story, I don't share it like, oh, nobody else knew what they were doing until I got there and then I saved the day. We've all worked with that guy, okay? But just more about I'll never forget this one patient. More about I never thought this was going to happen. And I think especially where we learn a lesson, where we get schooled, we've all got various degrees of education, but still today, our patients are our best teachers. If you lose sight of that, it can be kind of a little dangerous road to go down. But when you talk about learning through storytelling, I very well remember before I was an RN, sometimes if it was slow in the ER or if we went out after work, different ones kind of telling a story or something that happened. And I remember thinking, I didn't know that was going to end that way, or I didn't know what they were talking about. And it's kind of interesting because when you get together with friends from work, we usually say, nobody talk about work. We don't want to talk about work tonight. And everybody says, don't talk about work. And then what are you doing 5 minutes later? You're talking about work because we understand that we get energy from that, and we can certainly relate to those stories. Another thing I would really, really tell you, if there's one takeaway today, that is, I hope you write it down. And I was a person who, and I can remember it was 1979. I remember a patient said something, and I was like, I never want to forget that. And I had a yellow legal pad in my locker, and I wrote it down on the legal pad what that patient said. It was just like one sentence. I don't remember what it was today, but I remember writing it down. And then a week or two later, maybe a patient would say something else, or something would happen. And I didn't really keep a journal or a diary. I just would write just a sentence down, whatever I wanted to remember. Never, ever thinking in a million years I'd ever lecture on it, talk about it, or anything like that. But what I would tell you to do today is, and I mean this, put it in the notes section of your phone. We've got that there, and it's right there. Maybe not when the patient's telling you this, but afterwards, just like, just one or two things that you remember about that and add to it. And I swear I have had a bunch of people tell me, they started doing it, because I can tell you, I'm 68 years old. Things fade of what you did years ago, or what happened, or things like that. So I hope you do that. It's something where you kind of look back at that, and sometimes when I talk about these stories, I swear, you guys, I can picture where I was in the room. I can picture what doctor was there, what I just remember all that in kind of a crazy way. So anyway, so we'll talk about a couple of these. So first rule is, when you talk about taking care of patients, these are some unusual cases we're going to see, and things like that. But just remember, all psychoneurotic patients will die from a true organic illness. You don't die from being crazy. And just because somebody has a psych diagnosis doesn't mean that you can blow them off. And I've seen people get burned on this before, including myself, where you thought it was something with a mental illness. Mentally ill people still have MIs, they still stroke, they still get septic, they go into shock, they go into renal failure, they throw clots, they have a PE, all those kind of things that they do. Another little thing on this, just a little caveat I tell people is, we have a lot of patients come in with anxiety sometimes. And I know like sometimes somebody will plant the seed and they'll say, I think it's anxiety. And you know what? Probably is. Okay, that has a lot to go on, especially if people are transported, family members are anxious, the department's busy, a lot of stimuli, it may be anxiety. But it doesn't mean that anxiety does not need to be investigated. And when I think about through the years, most of the patients that I took care of that sort of up and died on me got anxious right before they did that. And that's something I really remember. Like, you just can't act like they're there. There's nothing wrong. Why is this person anxious? And the last thing you want to do is medicate it right away. You want to find out why they're feeling that way. You kind of check them out a little bit. So we'll go over a couple of things here with some of these patients. So everybody likes a bit of blood and guts. And some of you are probably eating a donut right now, and this don't bother you a damn bit. You're my people. But this guy came in the summer, and he's got both hands. He's has lost digits. Okay, so we go back to the right hand. He's lost his fifth finger. Here he's lost his thumb and his second finger. So it was in the summertime. He comes in. And at first actually was brought in by a private car. Not really sure what was going on. He had a lot of liquid encouragement with him that day. happened about 2 in the afternoon. So he had been drinking most of the day. And so, you think in the summertime, okay, what is this? And we don't really have a forum for questions and answers here very easily, but, firework injury, that was maybe a first thought. So it doesn't look like what you normally see, like explosive, jagged wounds there. Didn't really know at first what exactly had happened. Chainsaw or some type of saw that came up, wasn't an assault. All those things kind of figuring out. And what had happened, we had initially had the call that a guy was coming in and he had his fingers cut off. So this is what we're trying to kind of figure out before he got there, what happened and how it happened. So what happened to this man was he was cutting his grass, and he lived in Latonia, and he had hedges around his house, and he could not find his hedge trimmers, and looked all over. A neighbor wasn't next door. He thought his neighbor had borrowed them from him. And so with the help of his 12-year-old son, the 12-year-old son held the handles of the lawnmower, and he picked up the metal part of the lawnmower, where the blade is under it, and was running that across the top of the hedges to trim the hedges. And that's how he lost his fingers. Now, when you use that bad a judgment, I think if you come to the ER, it's okay to lie. Just lie and just say, you were whatever. I don't know. But this guy was like, no, I cut them all off. Yeah, I know. And so we had somebody go back and retrieve them. And I think they found 2, but I forget which one they couldn't find, but they, they got them back, but they were not able to be reimplanted. So anyway, so I was pretty strange. You just kind of think maybe let those hedges go until later on when we get a hedge trimmer. But these are our people also. So anyway, moving on. So, I'm sorry, that's the 2 that they retrieved. I forgot that we had those. But as good as they looked, they could not successfully reimplant them. So, okay, so this guy comes in, and this is night shift. I worked night shift for 25 years. We have a interesting set of patients and circumstances on nights, and he comes in. And actually, this guy was from Latonia too. I just thought of that. And the call was that we received, this many years ago, was a drive-by shooting. And it was probably about 3 a.m. And it was in an area of Latonia that was, I'm talking years ago. It's a nice area. The guy was inside his house. As you can see, he's an older gentleman. And just kind of like not the night shift or the drive-by shooting criteria, not the typical patient you would get at night. And so anyway, the story was when the guy got there, Covington brought him in, and he was very confused and disoriented. He didn't know what happened or anything like that. And this man slept in the first floor bedroom. It was a corner house, and his son slept upstairs. Adult son was upstairs, and the adult son upstairs heard a gunshot and came down as Dad was standing in front of a window. This is in the summertime, and he had been shot through the window and was laying there on the floor, blood everywhere and stuff. So he called the squad. So, of course, the police get there, and family is usually the first suspect in that, and the son is vehemently denying what's going on. So we don't really have the son to talk to. We just have the patient. So as we're kind of checking him out, it's like, wait a minute, this isn't a gunshot wound. This doesn't look like a gunshot wound that's going on here. So we're thinking a million things. Was it a suicide attempt for this man? Was it something where, he, put a gun to his head or something like that? Was it some type of assault that went on? Was he impaired? Was alcohol, drugs involved? He was very mixed up, but he did not He did not smell of alcohol. Of course, we don't have a blood alcohol yet. And a drug screen is going to take a while. We couldn't figure out any of the stuff that was going on. And we asked him, was someone with him? He said, no, he went to bed. And then, so we're trying to think there's something shady going on here, like we don't know what it is. As I said, I've worked nights a lot. I can tell you, when you worked at the North, you had a lot of street smarts in Covington. And I've seen men pretty seriously injured before when they didn't pay for their services, if you get my drift. So that's kind of a thought there. Okay, we don't know. We still can't talk to the son. The police are at the scene. This was before cell phones and everything. And so calling back, we're asking the police, about what's going on. And then the doctor, or I forgot who it was, I think the doctor asked the patient, do you have a dog? And he was like, yes. And we're like, okay, did the dog attack you? And he said, no, he's old. No, he didn't attack me. So you never know if the dog might have, I don't know, attacked him in his sleep. So we called back to the house, and they said, what's that dog like that he's got? And I've never forget, this police officer fined and said, well, it was a big old fat dog, and we had to wake the dog up to let him know there's 5 cops in the house and stuff. So we're like, oh, okay, we don't think the dog did this. And so when we think there's something shady, this man said, what time is it? And we told him, out no, by then it's 3:30, 3:45 a.m. Sunday morning. And he said, well, will I be done so that I can go teach my Sunday school class? And usually a patient who we're thinking of has some of these issues I talked about is not teaching Sunday school. So we're really not really sure what happened here. Maybe it wasn't sinister after all. So we took him back for an x-ray, of course, and there's no bullet fragments, no pellet, no nothing. He has not been shot. He's not been shot. So as the police are covering the perimeter of the house, they ended up calling back, and there was a metal window fan that was in the window. As I said, this was in the summertime. And what happened was the man woke up in the middle of the night and was cold, and there was no brace over this metal window fan. And he went over to turn it off in the dark, and he tripped over the big fat dog and fell face first into the metal window fan. And the fan fell out the window, into a window well, and the window came crashing down, and the guy's laying on the floor when the sun comes down there. So anyway, kind of a convoluted thing, but you try not to be judgmental. But in this line of work, we're a little jaded and we're a little cynical. And you try to give people the benefit of the doubt, but often we find ourselves saying there's more to the story. So the guy was repaired. He cleared up. His neuro checks were fine. Everything was okay there. And so he was able to be treated and released. But how it presented was certainly a completely different story. So I always try to remind myself to keep an open mind. The longer you've been doing this, sometimes the more it takes us to be impressed by something. And I try to keep that in mind because it's new to that patient or new to that family, but may not be new to us. So anyway, that was a pretty good one there. So this is a pretty nasty trimalleolar fracture and open fracture and dislocation. This is a nasty break. This guy came in on a Sunday, and just how things kind of get mixed up or convoluted. This is a good example. And he was painting something in the afternoon, and somehow fell off the scaffolding and stuff, and he has this nasty fracture. So squad brought him in, and he's alert and oriented. And in my experience, sometimes people that do that line of work may be a little buzzed or whatever while they're doing it. I try not to judge people. This guy was not buzzed or anything like that. So we put in orders for an X-ray and stuff, and I'm like, I'll get a line started on you, give you something for pain, and then we'll get this X-rayed. And obviously, he had to go to the operating room and stuff. So anyway, so I get the line primed and go get the narcotics and stuff like that, and I go back to the bed, and the stretcher's there, and like the grass and stuff, from the squad or where the guy fell is on, but the guy ain't on the stretcher. I'm like, where'd he go? And so I look, and I'm like, where'd the guy go? And they're like, what guy? I go, the guy with the broken leg. And the doc goes, apparently not really far. And I'm like, well, so I looked in the bathroom. He went in the bathroom. I thought, did he have to go out and smoke real quick? Because it was in bed 2 right at the north, like you could go outside. I walk outside, he's not out there. I'm like, where the heck did this guy go? And I look back, and our X-ray door down the hall, probably about 8 beds down the hall, was closed. And I remembered we had an X-ray tech that day that did not work ER because somebody called in sick, and they pulled her from the main side. And I thought, surely to God, this man was not walked back to X-ray with this ankle hanging off of his leg. So the door's closed, which means they're filming. So I knock on the door. There's no answer. I open the door. This guy is sitting in a chair. He's got his head down. He's pale. He's diaphoretic. And I walked over and I said, sir, did you walk back here to X-ray? And he said, yeah, but buddy, I don't think I can walk back. And I was like, oh my God, who walks a man with his ankle hanging off back to X-ray? But it happened. It's a long time ago. That person's been long gone. But anyway, sometimes you just think about how crazy can that get? And the guy I said to the tech, I go, why did you walk him back? And she said, well, I asked him if he could walk, and he said, I'll try. And I'm like, well, no, like, yeah. I said, we got a little lady with a broken hip. Like, don't ask her if she wants to walk back or cartwheel either. So anyway, it's how things work. So, all right. We all get the church calls, and we certainly get them on Sundays. And actually, I've been in church and had to help people during Mass and things like that. And there's a little thing with older people where they can be sick, but when it comes to time to go to church, it's like they got to go to church because they haven't missed a Sunday in 35 years or whatever, and they think they're going to go to hell if they don't go to church and stuff. So anyway, working a Sunday, it was probably about a little bit after 12. This is also at the north, and we got a call that there was a full arrest coming in. 90-year-old lady, full arrest in the car. They went to the firehouse, and they were working her. She had been down a while. She was asystole, but they were bringing her in, more likely to be pronounced. So we get everything ready. So get everything ready, and about 5 minutes later, she comes in. I mean, bless her heart. She's purple, fixed and dilated, asystole. We just checked a couple things and pronounced her. I think her downtime had already been 45 minutes. So her husband was there, and minister were there, and we went in the small room, and pardon me, told him. And then he said to me, my daughter's a nurse here. She's on her way down. And he said her name was Brenda. And I knew Brenda. I didn't know her really well, but I knew her. And I said, well, I'll watch for her and I'll bring her right back. And he said, okay. So kind of out there, and I see her walk in, kind of looking around. I said, hey, Brenda, I was taking care of your mom. And she said, did she die? And I said, yeah, Brenda, she did. I'm sorry. And I hugged her. And, that's hard. It's your mom. And she goes, was it quick? And I said, Brenda, we weren't there, but apparently it was. She was on her way home from church and just slumped over. And they took her to the firehouse, and she's been asystole the whole time. I think she died instantly. And she said, well, my mom had an inoperable thoracic aortic aneurysm. And she said, I hoped my mom would die in her sleep, as only medical people can say, because it was inoperable. And I said, it was quick, and she died on her way home from church. And Brenda looks at me and she goes, that looks good to God, doesn't it? And I'm like, hell yeah. I said, I'll probably fall off a bar stool or something, I mean, think how that's going to look and stuff. And I just thought, isn't that something that she said that looks good to God? Like in this crazy ass profession we have, we still got a sense of humor or a way to cope with stuff. And so this conversation was like maybe 15 seconds. And I said, here, let me take you back to your dad. So I take her in there and she sees her dad. And of course, they cry and hug and everything, and which is typical. And then, after a few minutes, she said, well, Dad, what happened? Well, how little old people, God love them, sometimes they tell a story. And he said, well, we were on our way home from church and I asked your mother, where do you want to go for breakfast? And she said, how about Frisch's? And I said, no, we went to Frisch's last week. How about if we go to Bob Evans? And she said, well, no, you got diarrhea when we went to Bob Evans that one time. And then she said, how about Waffle House? I mean, he's telling the story, and you kind of want to say, somebody just died here. We might want to speed this up. And then he said, I stopped at the stop sign, and he said, all of a sudden, your mother just slumped over on my chest, and her eyes were open. He said he said her pupils were big. He said, I knew she died right then. I knew she died. And he said, I didn't know what to do. And he was trying to he thought, I'll get to the firehouse. It was too far from the hospital. And God loving, there was a train. And so he had to go around and find an alternate route through the underpass. So he gets up to where the firehouse is, and he said, there's firemen out there washing their fire truck. He said, I just drove right onto that lot, and I was blowing the horn. He said, those 5 firemen came over. They got her out of the car, and those 5 firemen, they laid her down, and they started artificial insemination on your mom. And with that, Brenda went like that. And her dad goes, yeah, first one, and then the next one. Man, they were trying so hard. And then they were like rotating. And Brenda has her handkerchief up by her mouth. And she's like, and I'm like, I know she's laughing. She's trying not to not laugh. And the preacher is thinking that she's crying, and so I'm like, I don't know what I'm going to do. And then when I think it couldn't get any worse, her dad says, yeah, that man, they were really sweating working on her. And I just grabbed Brenda's shoulders and I said, she needs air to go out, to get her out of the room. And we fly out of the room, and I kick the door shut, and we sort of spill into the next door. And she bust out laughing. She was like, oh my God. She goes, my little dad said 5 firemen started artificial insemination on my mom. And I'm like, I know. And she said, I want to say, go mom, go mom. And I'm like, oh my God, this is crazy. This is just crazy. And we try to get it back together and start to walk out to go back in there. And then she'd be like, no, I can't do it. Wait a minute. So anyway, it's just one of those things that, kind of a sad thing that happened, all that kind of stuff. To be 90 and die suddenly, maybe not a bad deal as we look at things. But that happened many years ago. And today I'll run into Brenda. Maybe I'll see her at a class or something, or just down the hallway, very rarely. But whenever I see her, she says, go mom. And I say, go mom. And it's just one of those things, one of those memories of just crazy stories that we all lived through for sure. So, okay, so you see this eggplant here. You see that x-ray. I don't read x-rays for a profession, but I can read this one pretty damn good. I think you can too. So we had a guy who came into the ER, married couple. Actually, the only time I think that I've ever had somebody say, you know what, we were drunk and we smoked some pot and we were messing around and we got zucchini stuck. They don't ever say that, or cucumber, or a deodorant can, or whatever. They say it was sitting in the bathtub and they sat down on it. I never knew there was vacuum in the rectum like that. Or a toy was sitting on the bed and they sat down on the bed after the shower. And again, that vacuum made it go up. It's just an interesting phenomenon. But this couple, they were true, or honest and stuff. And again, I gave up judging people a long time ago. I'm there to take care of you. Just let's just talk. So we had to give this guy Versed, and we thought he was going to have to go to surgery, but he was relaxed enough, and the doc could get it out. Of course, we threw it away, and so since he had the Versed, we had to observe him for a while. Actually, a good probably 2 hours, something like that, because he was pretty snowed. They gave him a lot, as you can well understand, and he had something for pain as well. So anyway, a newer nurse I worked with was getting ready to discharge him, and she said to the doctor, she said, "Now I know, he's not going to drive. His wife's going to drive him. She needs to stay with him tonight. He shouldn't smoke, sign any papers, anything like that." And the nurse said, "Anything else I should tell him?" The doctor said, "Yes, tell him to chew his vegetables more thoroughly." And she's like, "Oh my God, I can't go in there now. I cannot go in there." And then when she'd try to kind of, collect herself a little bit, the doc would walk by and go, hung on like that. So, you got to have a sense of humor in this line of work. But I honest to God, we're so twisted. If I see eggplant as a vegetable somewhere, I swear I think of this guy, and that's not good. So anyway, we have interesting situations where we had a guy that came in, again, night shift, so intoxicated he had to be intubated, which a lot of patients don't realize. Yeah, you can die from alcohol intoxication. But this guy was just, I think his when we measured it finally, I think his ETOH was like 350, and so he had to be tubed, and he was at a party or something. So of course we got to CT his head, his neck, and find out what else going on. So we have him tubed, and the clerk comes back and says his friend or relative wants to come back to see him, and I said, well, he's got to go back to CT. No. And she goes, well, he says he's got medical training or medical information. And I said, oh, okay. And she says medical stuff about him, and I said, well, what's a visitor like? She goes, oh, he's real drunk too. And I said, well, hold him off out there. So anyway, so I go back to CT, come back with this guy, and then go through the realms. I got to put an NG tube in him and put a Foley in him. And the clerk comes back. She said, can that guy come back? I said, no, time to hold on. I still had a lot of stuff I had to do. And the doc was like, yeah, I don't want him in here. So after a few more things, the clerk comes back. She says, can somebody please come out and talk to this guy? She said, he's about to drive me nuts. And she wasn't being rude, but she said he's just, was kind of demanding. So I had another nurse watch this patient. And I went out and I said, which one is he? And of course, she points him out to me. And he's weaving. He's so drunk and everything. And he said, I said, hi. I said, can I help you? And he said, are you the doctor? And I go, no, I'm a registered nurse. I'm in charge of the emergency room tonight. He goes, man, I need to talk to the doctor. I got like medical training. I know like medical talk and medical stuff. And I need to talk medical to a medical doctor because I know medical and I need to talk to a medical doctor. I don't need to go through no damn nurse. I need to talk right to the doctor. And he's not being threatening, but he's just talking stupid and stuff. And I'm like, well, sir, I'm sorry, the doctor's busy right now. We just had one doc at night and we were hopping. And he goes, well, I got medical stuff to tell him. And I said, well, I'll tell you what. I said, why don't you tell me? And I'm thinking, what does he want to tell me? Is this guy like a hemophiliac or an epileptic? I don't know what he wants to tell. And I said, why don't you tell me? And I'll go back and tell the doctor. I'm trying to kind of loop him in. And I said, and if the doctor has any questions, he can come out and talk to you. And this guy goes, okay. He goes, and then, drunks can cry at the drop of a hat. And he's like, maybe it'll save him. I just want him to know this. I want him to know. And he starts like crying. And I'm like, well, what is it? He goes, well, you need to tell the doctor when we found him, when he was laying on the ground, man, you need to know he was in the fetal position. He was in the fetal position, man. And that's what they do right before they die. They curl up into that fetal position. And it's bad. I learned that in my classes. It's really, really bad. And I'm looking at him and he was like, it's the fetal position. You need to tell him. And I looked at him, and as I said, it had been a stressful night. It's probably 3 a.m. again. And I looked at him and I said, "Sir, you are exactly right. I am just a registered nurse. You do need to tell this directly to the doctor." And he points to Clark. He goes, "I've been telling that witch that for an hour." And I'm like, "Oh, come on back. Come on back. I live for these moments. This is going to be fun here just for a minute. Come on back." And so we go back, and it was actually Dr. Mark Griever was in the room. And I walked in and I go, "Dr. Griever," I said, "he's got some medical information." And Griever's looking at me like, "I'm going to kill you, Foster. I will kill you." And so I'm standing behind the visitor, and I said, he's got medical information. He needs to tell you. And this guy's like, "Doc, I'm so glad I got back here. Man, I've been wanting to tell you, like, I got medical stuff. I know how to talk like medical to you, like a medical doctor. Like, I know how to talk like that to you." And he goes, "Well, what is it?" And so he does the same thing. He goes, "When when we found him, he was in the fetal position, and that's how what they curl up into right before they die. And you needed to know that. I want to get back here." And Mark Griever is looking down, and I have no idea how this is going to go at all. And there was a pause, and all of a sudden, Dr. Griever goes, "This changes everything." And he like grabs this guy's shoulders, and he said, "You got back here just in time." And this guy goes, "I know. In just a quick turn of a dime, Griever goes, "And since you have medical training, we've got to do a whole bunch of different stuff now. So I'll have Terry take you back out in the lobby so we can change everything around because you got back here." And this guy goes, "I know. And so I thought that was a good exit for him. So I take the guy. We're going down the hall, and he goes, "I'm glad I got back. I'm glad I got back. I'm glad." And I'm like, "Okay." And like, I can't wait to get rid of him. And just as we start to get to the lobby, he turns at me and he goes, "When that doctor grabbed me, I pissed a little." And I looked at him and I go, "So did I." Okay. I'm like, I can't believe I did this. So anyway, I go back and the doc's not in the room. And I'm like, I don't know what's going to go on here. And this is a long time ago when we had clipboards, and sometimes they were thrown. We called them Frisbees. So I'm kind of looking for a Frisbee, and I walk around the desk, and Mark Griever's sitting there charting. And I said, "Hi." And he said, "Hi." I said, that was pretty good. That was pretty good. I appreciate it. And he goes, "That's okay." He said, "So they found him in a fetal position?" And I said, "Yes, sir." And he said, "Then definitely his diagnosis is shit-faced." And I was like, "My God, you cannot make this up. You just can't make it up for these scenarios here." So I try not to pass my judgments on other people, and some people put value on things that kind of surprise other people, but that's the way it is. And this was a Saturday, maybe about supper time. Got a call this was an elderly man, full arrest at home. They worked him, and when he got to us, they went in the room and they obviously started or continued to work on him while I went out. We usually have a nurse go out, as you know, talk to the family. Sort of, it doesn't look good, but also to prepare them in that way. But also, what did they want resuscitation wise, DNR, living will, all those kind of things, medical history, and does somebody want to come back? And we have to give all that pretty quick. Nobody wanted to come back. He had been ill for a while, a couple of things like that. So I go in and tell the team, and we did like another round of drugs and then stopped the code and pronounced him. And so went out and told the family, and then kind of prepared the room a little bit. And the family came back, and, the typical reaction, which is normal, is a lot of grief, especially when you see somebody the first time when they're dead. That's rough. And, reactionary grief and appropriate. And so then what I've seen through the years is, after 5 or 10 minutes of the shock, then there's a fair amount of reminiscing or just talking about some things. And they started doing that. And I had Sister Augusta with me from Pastoral Care, who was assisting the family. And with that, the one daughter I noticed had her head down the whole time next to the stretcher, and just wasn't really crying anymore, but just had her head down. And all of a sudden, the daughter raised her head up and she said, "Oh my God, you guys, he's with Dale now." And with that, the entire family just busted out crying. And he said he always wanted to be with him. And and they just were crying, and they're like, it's just good. He's with Dale now. And Sister Augusta, because this man was older, she asked his wife, did he have a son who died named Dale? And she said, "Oh no, we're big NASCAR fans. He's with Dale Earnhardt now. He always wanted to be with Dale, with number 3, and he's with you now." And Sister looked at me and she was like, I don't understand. I'm like, I can't explain it. But true story. You just sort of think sometimes somebody might say he's with the Lord, he's with Abba, whatever. But he's with Dale. So there you go. This was at the north. I don't know if you're noticing a theme of drunk people here, but guy brought in or came in by private car, and he was like in his 40s. He was like, hey buddy, he said, "I'm going to tell you right now, I'm really drunk." But he had a big parietal laceration here, saved by the infamous sterile clean bar rag that is used for a lot of injuries. He's got that on there. They always want that one back. And he was telling me, he goes, "Man," he said, my wife knew where I was going. I had designated a driver. He was out with a bunch of high school friends. So the last bar they were at, somebody got in a fight like 3 or 4 tables down and threw this big beer mug. It happened to hit this guy. He didn't even know those people and stuff. So I think that the guy who threw the beer mug got arrested. So anyway, I'm like, we'll get you taken care of. So we cleaned his wound up and got a blood alcohol. And he was very drunk. I forget what it was, but he's very cooperative. And CT'd him and everything. It took us a while to suture him. And so I dressed his head wound and everything, rechecked his vitals, all that. Got sitting him on the side of the stretcher, and I said, "Who can I call to come pick you up?" He said, "Well, my buddy brought me in. They should still be back out there." Well, working nights was my career. One drunk is often brought in by another equally as drunk. They travel in pairs a lot. Or what happens is sometimes one drunk drops off the injured drunk, and then the first drunk goes back to the bar or the party, wherever they're at. So anyway, I thought I might have this guy all night. So, or 2 drunks all night. So he goes out to the lobby, pardon me, and sees his friend, starts talking to him. And I had to print off the instructions there at the desk. So I printed them off, and I walked over and I said to his friend, I said, "Would you be able to take him home all right?" And he said, yeah. His friend stood up. He wasn't drunk or anything. And since the patient was married, his wife didn't know he was injured. I said, he can't just go home and go to bed or sleep in a car. You got to wake his wife up, and she's got to check him tonight because he's intoxicated and he has a concussion or mild concussion. So I need to check him every hour. You know the drill. And so they go, okay, so off they go. So about an hour later, I go out to get another patient. The guy that's the driver is back out in the lobby. And I said, did you have to bring him back? Because I told him bring him back if there wasn't anybody home. He said, no, I got him home all right. And I said, okay, could I ask what you're doing back here? He said, my wife's back there with stomach pain. I said, did you bring both patients in? And he said, no, I never saw that guy before in my life. And I'm like, what? I said, I thought you were his friend. He said, no, he walked over to me and said, could I have a cigarette? And I told him I don't smoke. And then that's when you said, would you be able to take him home? He said, I figure I've been sitting here a while. What the hell? I'll take him home for y'all. And I'm like, oh my God, I sent a patient home with the wrong family. Like you think one or the other would have said, I don't know him. But off they went. And he said, yeah, but his wife died when I woke her up. I said, what do you mean? He said, well, he couldn't make it up the steps. So he told me go up as the first bedroom on the right. So I went in, shook her, woke her up. He said she put her glasses on, put her teeth in, and then she came down and read that paper, and she knows to call you if there's anything wrong. And I was like, sir, I will expedite your wife's care as quickly as possible. Would you want 300 Vicodin maybe to keep this quiet tonight if I can make that happen? Or But anyway, that's a true story. And you know, it's crazy. You think the best writers in Hollywood cannot make up a story like that. But when you think about it a little farther, again, we get a little jaded. There still are really nice people in this world who will do anything you ask them, and people who are kind. And it's kind of like a nice reminder of that once in a while. So what makes us all great EMS professionals? Well, there's a lot of things when you think about it, but we have a skill that you don't learn in school, how to tune out a drunk who every 3 minutes is yelling, "I gotta pee." You can yell, you know, when they're in the department, it's like, "You have a catheter," and they're like, "Okay," and you yell, "Go ahead and pee," and it's like, "I can't, I got a catheter." You hear that. We have selective hearing. You know, when people are like, like that, sometimes we, again, selective hearing, and somebody will say, "How do you stand that yelling?" And we'll say, "What yelling?" Because as long as it's going on, I know the patient's alive. When the yelling stops is when we got to check that out a little bit. Okay, that's when, is that guy hanging upside down? I've also learned in this line of work, for each decade over the age of 50, the patient will have at least one more layer of clothing on. If you got a 90-year-old, 89, 90-year-old, they got 5 layers of clothes on. They really do. That's a given. And I mean, even in the summertime, but especially this time of year. And what's so pleasant is when you're taking those layers of clothes off, how it kind of snows in place there. You notice that just kind of snows in place, just like a winter scene on that stretcher. I've learned how to place fairly accurate bets on blood alcohol levels. You have to be closest without going over. I think those are always kind of interesting. One time at the in the ER, I got a call. The clerk said they have a blood alcohol level that they have to give it to a nurse or a doctor, and I said, "I'll take it." And the layup tech was very, you know, kind of frantic. And she said, "I have a blood alcohol that's incompatible with life." And I said, "Oh, okay. I think I know who it's on." And she said the name, and I believe it was 600. And I said, "Okay, thank you." And she said, "So this is this." She knew I was a nurse, and she goes, "Are you going to tell the doctor?" And I said, "Oh, yeah." And I said, "I'll also tell the patient after he comes back in from smoking." And she goes, "What? There's no way." I'm like, "No, he's out smoking and he has a blood alcohol of 600. And she said, "How do you explain that?" And I said, "It's the first of the month." Because when people get their checks, was checks back then on the first of the month, they go through the alcohol very quickly. And then they have a cyclic thing where then they go into withdrawal towards the end of the month. I've just seen it many, many times. And I've often said, if we had a vending machine in the ER lobby, take it, bring it out about 9 o'clock at night, put it back about 6 in the morning, it would decrease our unnecessary visits probably by 75%. You just need 5 things: a sandwich, a home pregnancy kit, a care voucher, a work excuse, and a prescription for Vicodin. I mean, it would just be like if they come up to the desk and they want one of these things, go to the vending machine. Yes, sir, you can go to the vending machine. Yep, you can go to place your order, enter it on the vending machine, and that kind of stuff. I mean, when they talk about greet them, treat them, and street them, I can't think of a kind of a better way to do that. But it is interesting, and even the unnecessary visits, we still need them and take care of them. And sometimes I'll hear somebody today say, "I can't believe somebody's using the ER for this. I can't believe somebody comes to the ER for this." Well, folks, they were doing it 50 years ago, and they will be doing it 50 years from now. It's just the way it is. Greet them, treat them, and street them. Just get it done, get it over with. If that festers, if you engage in all that, it's a lot of wasted energy. Just take care of them, and let that go. So finally, the nurse asks this question: "Are you sexually active?" So we have to ask this of any female of childbearing age who comes to the emergency department, because what we want to know is if there's a potential for pregnancy. Because if there is, you always consider somebody could be pregnant with abdominal pain, anything like that. Even though they're a virgin or have never had sex or whatever they want to say, You have to have that in the back of your mind. We've seen many, many, many immaculate conceptions. Okay. If they're pregnant, there's a lot of times we're not going to CT them or X-ray them. What measure are we going to give them or not if they're pregnant? But then also, what does it have to do with their illness? Maybe that might be part of it. So we have to find out if they're pregnant. So when we say, are you sexually active? All we want to know is if there is a potential for pregnancy. However, here are three of the best answers to, are you sexually active? The first one, are you sexually active? No, I'm married. Okay, that was good. The second one, are you sexually active? No, but my husband is. Okay, I don't know what to say to that at all. And then third, and perhaps the best, are you sexually active? Not really. I just lay there. And it's like, oh my God, I'm not asking you this stuff. I'm not asking you this. You please don't volunteer this. But as you know, when we are in this profession, people volunteer things to us pretty readily. So anyway, what I would encourage you to do again is to document your stories. And once you start putting them in the notes section, you'll think of them like, you're waiting for an appointment. Oh, I might write this down. You're at a kid's game. You're at some boring talk, like maybe now or whatever. Put those in, and you will add to them, and you'll be glad that you did it. I've had several people say, I did start doing it, and I'm adding more to it, because I've had so many people come up to me who've been in this line of work as long as I have, and they're like, I wish I would have written things down. And you still can. It's not too late. I can remember this stuff that's not even written down, part of these stories from years ago, but as I said, it kind of fades over time. So anyway, so these are, just some of the bizarre, crazy stories that we all have. This presentation is often done best in a bar, okay? Or maybe that's where you're at today. I'm not, but it's a little bit of, can you top this? But it really is a learning thing. So I hope you put them down. I do have a Facebook page if you want to like that or follow that. It's Terry Foster RN. I try to put only positive things on there. I don't put anything political at all, but just I don't know, just positive things about our profession or things like that. You'll see some grandkid pictures and stuff like that too. So anyway, so I thank you very much for your attention. I'll stop sharing here, and I guess I'll just go back. I guess you can see me, or do you need to see me, or Tony coming on? So any questions or anything like that you need me to cover, Tony?
So they do have the ability to chatter Q&A with the teams.
Sure.
I think that the takeaways is we really do have one of the best jobs in the world, because some days it's absolutely miserable, but some days you got some stories. And at the firehouse, the kitchen table is the bar, we'll call it, and these are things that should be done at the kitchen table. These are stories that should be told, because especially when you've had a run of bad runs and you remember the good side of things. And my last point to all of this is I didn't write down any of the fun stuff. I have some memories, and I have friendships through all of this, but I also have a me file. I call it the me file, ME. And I've had some good runs where people have gone home to their family, and I gotten letters, I've gotten thank yous, I've gotten these things, and I stuck them all in a little file. And we do awards for best door to balloon time, best needle time, and all those things. And when I'm gone and my kids are going through all my crap, they're going to find this file, and it'll be something to be proud of. So,
well, Tony, I think your kids are proud of you no matter what. But they're as you see that commercial, they're not going to want your spoon collection. Okay, I can tell you that. All right, but these kind of stories, to me, when I think about what exactly what you're talking about. It's interesting because I have the same thing, just a note or two, or we used to have Excelgrams or a card from a patient, and I may not remember them, but I can read that and I remember it so well, and I hope people do that. There is a question Diana Morgan asked about, how did you get involved in Untold Stories of the ER? They called me. Actually, I was going to do this exact talk about 15 years ago in Seattle, and it's filmed in Vancouver, British Columbia. And two producers called me and said they wanted to hear my talk and then maybe use some of the stories for the show. I thought it was a joke. I thought my neighbor and I play jokes on each other. This was before cell phones. And when they left their number, I was like, it was in my office at St. E's, and I'm like, I'm not calling this number. It's gonna be a phone sex number or something like that. And I waited till I got home and I called, and it was legit. And so they came to hear me do the talk, and they heard the talk. And when the talk was over, it was two young ladies that were like associate producers. They said, your talk was really good, but we can't use you. And I was like, oh, okay. You all approached me, and I said, why can't you use me? And she said, we only have doctors on the show. And I said, oh, okay. Well, these are all my stories. And they're like, well, they're great stories, but when you only use doctors. And I said, how come? And she, the doctors are there to tell the nurses what all to do and stuff. And they run the show. And so I said, after I had a stroke right there, I said, could I just kind of, because they're not medical. I said, well, this is what I do. And when I explained it all, they're like, well, that sounds good. And so I was the first nurse to be on the show. I think they've had two others since then, but, and it, in a way, it's a positive thing for nursing, but we work together, that the docs aren't nurses and the nurses aren't doctors and stuff. And like one script, they had the doctor getting the patient dressed to go home and wheel him out to the car. I'm like, oh, hell no. Okay, that's not how we do it. But more things about, like, there was a trauma patient on the one, and when I got in the room, the doctor said, Terry, start 2 large bore IV stat. And I'm like, I would have had the lines in maybe before the doc got in the room. And I'm not competing with the doc. I don't mean it like that. So, it was kind of interesting. But the show, I think the show's defunct. Since it was internationally filmed during COVID, it was put on hold. And I get an email periodically. They're thinking about starting it back, but it still shows a lot. Because I have people text me that they watched it or whatever. But I just I think it's gone. So, and just remember how famous I am. I'm on the same channel Honey Boo Boo was on. Okay, so there you go, right up there, and then the 1,000-pound twins or something like that. So, thanks, Diana, for your comment. Thank you.
All right. Well, we're gonna wrap it up. If you've got anything more for Terry, he's always reachable through his Facebook. And thank you all for attending. We send out the certificates for everybody logged in through your email, and I will see you in March. We're going to go over the changes in ACLS, PALS, CPR, kind of the justification for those changes and how it affects us. So thank you all again, and we will see you soon.
Okay, thanks for having me. Thank you all.
Thank you, Terry. We'll see
thanks, Fort Thomas. Thank you, guys. Thanks, Justin. A lot of nice people on here. Thank you.